Hi, this is Charmin here. Today I'm going to talk about blocked arteries and heart transplant. So if you're interested, please continue watching. So your heart needs food and oxygen from its own blood supply. So who carried this? That is coronary arteries. Coronary arteries carried food and oxygen from blood supplies, but these arteries get blocked when you have heart disease. So how arteries get blocked? Well, fatty substance that is cholesterol can stick to the walls of an artery. Then arteries become narrower and blood supply gets slow down, and that so cholesterol can make artery walls rough, and this causes blood to clot and then artery block completely. Healthy artery cut open, and this is clean shiny inner surface, all right, and this is thick wall of cholesterol. So an artery partly blocked by cholesterol, so here is a blood is not going properly, and this is so here you can see this is a blood flow, and here's a cholesterol breaks away from artery wall, and cholesterol blocks the artery, and here you can see this is blood flow along the artery stops, can break off into the bloodstream and block narrow blood vessels. Thrombosis in blood vessels in the brain is called stroke. So brain cells die, and persons suffering from stroke may get paralyzed or even die. So if a coronary artery is partly blocked, the heart muscles get too little food and oxygen and causing severe chest pain, and that is called angina. Alright, so if heart becomes very badly diseased, so it replaced with a healthy donor heart by transplant surgery. So you can do it. You can find a heart healthy person and by a transplant surgery. So transplant surgery stop the patient's immune system treating transplant. So yeah, so that's all. Thank you very much.